get somebody else. Get somebody else. Yes. Hey guys, welcome back to my channel. Yes, I have the hair out today because I wanted to, because the room is a little not so decorated. I wanted to, you know, have something that pops, so I let my hair out today. So welcome back to my channel. Thank you for liking, sharing and subscribing. I really and truly appreciate every single like, comment and everything. I've been seeing them all. I've been seeing the views, and I'm so appreciative of every one of you who took time out of your day, 20 minutes, half an hour, even the ones who, you know, binge watch my videos. I really and truly appreciate every single one of you guys. Mwah. Thank you. Today's video is going to be about things to know before booking a hospital for delivery, if you do choose to have your baby delivered at a hospital. I'm very passionate about this topic because if I had known, it's always if I had known. If I had known, I probably would have selected a different hospital, because that hospital, I find that wasn't the best hospital at all. Like, out of all the hospitals that I could have, like, when we could have choose, I really chose like maybe the worst one ever. It's so twofold for me because, you know, I'm so happy that I can get to share my experience so persons can learn from it, as well as, you know, maybe wishing I had gone through what I did at that particular hospital. Yeah, I'm very passionate about it, so I'm going to be using my experience to tell you what I think you should always consider if you're going to be choosing a private or a public hospital in Jamaica. What I find is that so far communication is definitely an issue in Jamaica, so sometimes they may not, you know, give you all that you need to know. So these are some of the questions that I would ask and you know, push you to ask if you are going to be booking a private or a public hospital for delivery. Now, this information is by no means any medical advice, any at all. It's just my opinion on what I think, what I would have done if I didn't know. You know what I mean. The first thing is, before you book a hospital, is to obviously get a tour of the facility. This is extremely important. You know, you want to go in, you want to soak up all the feels. Am I comfortable in this place? Try to pay attention to how you feel as soon as you walk through the doors. You take a look on, you know, you absorb the energy of the environment of the space. You acknowledge and look at the different nurses, the different workers, down to the people them who clean the place. If you're taking them energy, everything like that is what you should pay attention to. So one of the first things that I think that you should look at now when you're touring the facility is the type of equipment that they have there. Now, the hospital that I went to, their equipment was definitely, or some of it was definitely not up to standard, for sure. So for example, the ultrasound machine, I remember when I was in labor and I did an ultrasound machine, I couldn't see anything from on that ultrasound machine. Like, I couldn't, you know how, like, if you go town, if you're in Kingston rather, for those persons who aren't familiar with Jamaica, if you're in Kingston and you would go to, you know, an ultrasound, anywhere that does ultrasound or whatever, you can see clearly, you know, the different organs in your body. You can see a clear outline of the baby. This hospital, I could not see anything on the ultrasound machine, right? And it scared me a little bit, right? Because I couldn't identify anything. Also, the reading that was given from the ultrasound machine at this particular hospital that I was at was wrong. They told me that I was about 3 days away from 40 weeks, which is, you know, when you're supposed to be delivering the baby. And the results from that ultrasound machine showed me that I had a preterm baby, which was, I think, around like 34 weeks or 35 weeks or something like that is what their results showed me. And while being in labor, I almost had a panic attack because I'm like, why is it showing me that? You know, all the other ultrasound machines shows me that I'm on time with delivery, but this one is showing me something different. So being in labor, already in my feels and emotions and body just going through a whole lot, this reading just, you know, threw me like for six, because, you know, like, why would I, like, I don't want to be having a preterm baby. I didn't prepare to have a preemie, is what they would call you know, a premature baby. And there's nothing wrong with having a premature child, because they come out to be beautiful children, but I'm saying I didn't make any preparations, or I wasn't mentally prepared for something like that. Going back to the whole thing, ensure that the equipment is properly done. That being said, you want to ensure that there's a neonatal intensive care unit. So generally with a lot of private hospitals, they sometimes don't have one, and so if there's anything that's any issues that may happen with the baby after he or she has been delivered, one has to go to the public hospital for, you know, any emergencies. So you want to make sure that if the baby born and, you know, there's any issues or whatever, you want to ensure that that hospital, you know, has like that unit to take care of them. You don't want to having to be worried about being transported now to like a different hospital. That just raises anxiety. That's a red flag as well. You want to be comfortable, you want to be sure of everything that's happening, you want to ensure that your surroundings can cater to you in the best way possible. It's really and truly all about you, the mommy, of course the baby as well too, but if the mother not comfortable, you're just gonna have, it's like all wrong delivery. It's just not gonna go, you know, according to plan. So we're still on equipment. You want to, you know, find out, okay, then in the delivery room, is there gonna be a fetal monitor? You know, you want to find out if I'll be seeing my baby on a screen, the ultrasound screen. You want to find out if they're going to be having anything to monitor the baby's heart rate, in terms of, I don't know what they call it, but some hospitals have this thing where they strap like a tape around your belly to see the progress, or to see what happens when baby is, you know, coming down or whatever it may be. I don't know what happens for the C-section part of things like that, but I know that usually is a thing as well too. My hospital did not have that at all. So the only thing that they had, I was barely being monitored as well. You know, I remember barely being monitored at the hospital. I remember there was this point where I was just like, it was just me alone and God in the room, just me alone in the room. And for me, that was very uncomfortable. It was very cold. It was uncomfortable. And when I was calling the nurse, nobody showed up. It wasn't the best thing at all. So you want to make sure that, you know, at least if you know, say you alone in the room, you want to see, at least to see a baby on the monitor or on the screen or something like that. So that's it for the equipment. I'm not sure now of what else you can ask for, but definitely have those things in mind, or you can always do some research to find out the best facilities that are needed as it relates to equipment when it comes to the touring and of the space. Still on the whole tour thing, you want to find out, or you want to see what the delivery room is going to look like, and you want to see what your private room, or I guess the room after you deliver the baby, would be. You want to also find out if you will be laboring and delivering in the same room. Some persons or some hospitals do it differently. So you want to see the space where you're going to be after delivery. You want to find out if your friends and family can also be in that room with you. You want to find out who can be in the room with you during delivery and after delivery. You want to find out the visitors' times, if any. You want to find out if your partner or whoever is with you can stay overnight in the room with you. You also want to find out the frequency of visitors. You want to find out how long you'd have to stay in the hospital after birth. You also want to find out if your baby will be getting the shots at that particular hospital. No, not every hospital will give the baby shots. Sometimes you deliver and then you have to get the shots after delivery, right? In public hospitals, I know that they give the shots right away. You get 2 shots or 1 shot after you deliver the baby. private hospitals, a lot of the times they don't give the baby shots immediately after, but public hospitals you do. So you want to find out regarding that and make preparations, because you want to ensure that your baby is vaccinated and, you know, like safe. You want to find out if the baby is going to be in a nursery or beside you. Where I was, I'm so thankful that at least the baby was beside me. So, you know, she wasn't like among other babies per se after she was delivered, because I didn't see her right away, because I ended up having to do an emergency C-section. I'm gonna get into that. So after, you know, they took her, she was in the nursery, and then, you know, after I woke up and everything like that, they brought her back to me. So she slept beside me for the entire time. She was basically with me the entire time, which I'm very thankful for. I know that in public hospitals, sometimes they take the baby and they bring them to a nursery. And I don't know how, you know, I don't know what else, but you want to find that out if the baby's going to be with you or, you know, be taken off somewhere else. Also want to find out how long you'll be in the hospital for, based on the type of birth that you have. So if it's a vaginal birth rather, people don't say natural birth anymore. Well, they do, but I guess because of the whole being mindful of this and that, and there's so many different labels, so you want to find out, you know, if how long you're gonna stay in the hospital, whether it be a vaginal birth or a C-section. Also very, very big, even though I don't know if this is still a thing, but you want to find out their COVID-19 regulations. Oh my god, should I have blooped that out or something? I don't want my video to go on like a radar. But yes, you want to find out their regulations. So you want to find out if you have to be in a mask, who will be in a mask, you know, what if you have COVID, what will happen to you, what if you end up having COVID on the day of your delivery. You want to find out, you know, what's gonna happen if you, like, what are the different precautions that you would have to take and your partner would have to take, and you know what's going to happen after the baby has been delivered. How long will it take for you to see your baby if you have COVID-19? Like, it's just like a whole thing. And I'm so, even though I had my baby during the time of COVID, it wasn't as bad. But I remember I had a friend, she's probably watching this video, and I think she will know who I'm talking. She will know that it's her. Yeah, so what happened, my friend, she had booked a private hospital to have her baby, and unfortunately her partner, her husband, got sick with COVID-19, and she ended up having to go to a public hospital rather, and her partner wasn't with her, or her husband wasn't with her. So what had happened was, because of the whole COVID-19 thing, her husband had to be at the window watch. So she was in there, the delivery room, alone with the nurses, but fortunately her partner was outside at the window in the rain, just being there with her. I don't remember what she said after the baby was born and stuff. I can't remember exactly what happened, what she said, but you want to find out, like, with the whole COVID-19 restrictions and regulations, you want to find out if that's still a thing, because you don't want to be unprepared. Trust me, when the baby born, it's just like you want to see the baby, you just want her or him on your chest, and you just want to be comfortable after all that drama, all that this and that, and anxiety and physical and, you know, been throughs and whatever. You want to have your mind at ease as best as possible, so you can just focus on the task that is in front, which is to deliver the baby safely. Something that may not be as important, but I find it important, is if they will have hot water. I did not have hot water, okay? I had cold water, and that was, I don't like cold water, to be honest. Like, I have to prepare my mind mentally for in a cold water, and after all of that, just like physical labor and this and that, we must go in a cold water. No, hot water to relax the mind, body and soul, yes please, hot water. And we're still on the whole tour thing, you know. And one of the things as well too you want to find out, maybe the last thing on the tour, is what kind of pain relief or pain medication that they have to give you. No, I'm not sure if all hospitals do epidural. The hospital that I went to, they don't do epidural, or they did not do epidural. I was dying for some pain medication relief, but that did not happen. I can't remember what, well, according to them said them did give me some pain relief, but they certainly did not give me that, or I don't believe they did, rather, because the pain of the contractions, they got worse. But which is so strange, because you know what happened was, my contractions were coming on very, very, very quickly and intensely, and as soon as I had asked for the pain relief and they had put me on a drip, my contractions, they got slower and slower and slower, but the pain was still as intense. So I'm not sure if they gave me something to slow down the contraction, or it was like an actual pain relief. I don't know. But just thinking about my birth experience, so many unanswered questions, and looking back at it, I remember every single moment, or most of it. And yeah, so you want to find out what kind of pain relief they have, because you want to be sure that they're not giving you what's not needed, right? What's not needed. Because trust me, them hospitals sometimes, them negligent, and they feel like they know it all, when really and truly they don't know it all. And I just want to insert here that as a woman that's giving birth, women, nobody knows your body more than you. Like, nobody knows your body more than you. Yes, they may have the expertise and the advice, and they've been doing it for over 30 years and whatever, but nobody knows your body more than you. So listen to your body, listen to your mind, trust your intuition, because I honestly, really and truly believe that, you know, we know what's best a lot of the times we know what's best. It's just because we're just so caught up in the pain, in feeling the pain and the contractions and everything happening around us. Sometimes we're not as in tune with you know, just in tune when it comes to certain things, when it comes to, you know, somebody just giving us advice and things like that. Like, we know, like, in the moment, if we just anyhow we find a moment of peace in during all of that pain and excitement and the contractions and just everything that's happening around, like, we're totally untouchable, we're unstoppable. Where was I? My phone ran out of space. So things to know, point 2 is you want to know your nurse and your midwife. Trust me, you want to know, you want to feel them energy, you want to sense, you want to get a sense of their personality, of their persona. You want to see their attitude, them attitude check, if they listen to you, what kind of, you know, like how they speak, how they listen, how they support you. You know, you want to find out how present they are, you want to find out their experience. A lot of these things, you know, you want to ask and you want to have a discussion with them about. If somebody gets offended by you asking their experience, it means that they are not the right person for you. They're not the right person for you. Trust me when I say that, because you just want, you're asking these questions to determine your level of comfort, to determine how safe you will feel, right? And if them don't want to tell you, no, go and go find somebody else, girl, because that person is not for you. Okay, tell me that. I remember the person who because I know that they did something wrong. And when I was trying to ask her about it, she got very defensive. She got defensive. And for me, I don't think you can, not you can, I don't think it's, you know, how it's empathy, I guess. It's also not about you and your work. It's about me and my comfort level. And it's about me wanting clarity on whatever it is that happened. And if you cannot provide that, but if you're being defensive and all of that and not even listening to what I'm saying to you, it means that one, you're guilty, and two, it means that we just weren't the perfect match. And you just want to make sure that you find the perfect match for you. You want to find somebody that you can discuss your birth plan with. When it comes to birth plans as well too, you can just download, you can research on the internet the different birth plans, so you know, so you have like everything together on one paper, because maybe some birth plans may have different elements that the others don't. So you want to go through and research a lot of them, so you know what it is to expect and what it is that you actually want, and discuss this particular birth plan with your nurse and midwife, and have a rapport, because you know they're going to be there with you. You want to, as I said, you want to be comfortable. You know, you don't want to be worrying about if this person has like good intentions for me. You don't want to be worrying about that person wanting to go home, to rush to go home. You don't want to worry about this. See, hospitals have this thing where it's a shift thing, right? And when the shift come to an end, everybody wants to go home. Now, you want to know that if your baby coming at a time when the shift go end, you don't want your nurse to be, you know, hurrying you to be doing this and to be doing that, or to be sidetracked by wanting to go home. She had tried to pack her bag when you call for help. She had pack her bag and do whatever, or them and switch over. You want to make sure that both of you have an understanding. And that's why I think, you know, it's important to maybe find out if you can have a midwife or a doula in the private or public hospital that you're going to be at, if you're booking, you know, one of those things. You also want to ask this particular question, because if you go to a private or a public hospital, chances are there will be somebody else that's having a baby, and maybe that person would have, maybe that nurse or midwife would have to be tending to that other person. You want to ask her what are her methods and what is her strategy for multitasking or for dealing with more than one patient. Them have this thing where they just want to get things over right away, so they might come up with a lame excuse like failure to progress, so that they can do a C-section and they can just like get you out of there and focus on the next person at hand or next persons at hand. Don't let that be you unless it's like completely necessary. You want to have all of that discussion with her. Be very clear, be assertive if needs be, and let them know that this is what you want. If they seem resistant or defensive, get somebody else. Get somebody else. Yes. Another thing you want to find out as well too is after birth, you want to find out if, regarding the umbilical cord, you want to find out who cuts it, when is it cut. I would advise for the umbilical cord being cut, you want to, Jamaica just, honest to God, yeah, Jamaica, a lot of the public and private hospitals out here, they cut the umbilical cord straight away, when you should not be cutting the umbilical cord straight away. You should actually give it some time for it to pulsate, because the baby is still getting nutrients from you. There's still some passing over happening, and when you cut it like immediately after, then that baby just loses all of that niceness, that goodness and whatever. So you want to ensure a couple of minutes pass, and also both of you guys are still connected at the umbilical cord. So you do want to have the umbilical cord cut right away. Just give a little bit of time. You even not go busy about that, but try to think about it. Give it some time before you cut the umbilical cord. You want to find that out as well, and who gets to cut it. Sometimes the husband gets to cut the umbilical cord, and you know that's special to them. Everybody just hurry, rush, and just want to go about their business. So no. Find out that. Also want to find out if you'll be able to have skin to skin immediately. If you want to, this is also going to be a part of your birth plan, but still ask skin to skin immediately, or if you want them to wipe up the baby first before them put the baby on you. You want to find out the type of formula that they're gonna be giving your baby, because some women aren't able to produce breast milk at the same time, or able to feed the baby at the same time because maybe their body not producing enough. And you want to advise them or tell them that, well, if you don't want to breastfeed, I feel you want to tell them that when they're feeding the baby, they don't give the baby the nipple bottle like that. You want to give the baby like a cup. So open the baby mouth and you just give them the formula or the breast milk like a cup. I say that because the nipple cover, you don't want the first thing that the baby feeds or feels or latches onto is the cover, because I think that's such an important time or important bonding moment for the mother and the baby, is to latch on the mother breast. So you want to tell them that you don't want to feed the baby with the nipple cover. Do it with the nipple Yeah, I had to drink some water because throat is dry. So I was saying that you don't want to have the first contact or the first big bonding moment to be your baby sucking on a bottle. You want her to be on your nipple. That's if you're into the whole breastfeeding thing. I was so happy that my baby latched, because I didn't see her directly after them clean her up. That's one of the things that really bother me to this day, is that I didn't get to see her, or she didn't get to see me immediately after. I'm so happy that my mom got videos of when they had her, because up to now I can't really watch that video because of the guilt that swallowed me up. I wasn't there to receive her or to really get her. I wasn't there to. It's crazy. I think mothers would know. It's almost say, I don't know, it's crazy, but I felt really guilty, that I was the first person to actually hold her. Next thing you want to find out as well too is what kind of birthing equipment that they have. You want to find out what kind of positions you can give birth into, or positions allowed. Some persons on their back, which is the most uncomfortable position, I feel. You can either on your back squat, you can do what this been go on all fours. Yeah, you want to find out if they have a squat ball, if they have different things like that. Hospital that I was at, they did not have any of those things. The squat ball. I was told that I could not, once I'm on the bed, I was told that I could not get up to walk, because you know that when you walk and the more active you are, especially in labor, it helps to bring the baby down. I was told that I could not walk, and I knew that when they said that to me, I was like, what? But the lady, as I said, the nurse or the midwife, she was just so overpowering, and I felt like, it's the first time I'm having a child, and you would believe that the persons who are experienced would have your best interest at heart, and that was not the case with her. One thing as well too that I would advise is relating to contracts. Now, the contract that you sign is to basically exempt the hospital or the nurses from any type of prosecution that you may consider based on what happened during labor and delivery. Now, I would advise that I'm not a lawyer, and I wasn't aware that we had to sign a contract during labor and delivery. And so, first of all, who does that? Like, who presents a contract to you during labor and delivery when you're just like you're in pain and like you can't focus on reading all of that? Like, I mean, you may have some superwoman out there who can do it, but me couldn't do that. I remember though, she presented it to me, which is so strange. That's something no say, but kind of have sense, you know. That's something no. I remember when I was laying on that delivery bed, and I was in labor. I was in really serious pain with the contractions, and the nurse, she brought the document to me to be signed twice, and I told her no, I'm not gonna be signing it. And then no, when my OBGYN came, I signed it because I felt like I could have trusted him, but I could not trust him. And by the way, this is not even a case, this is not even a way to scare you. This is really just to provide information based on my experience, and hope that you will, learn from this and take whatever you will from it. And if you're going to be posting anything, I would hope that this is posted in context, because I know how the internet can be, and I know how some of us can be. Where was I? Yes, you want to find out about the contracts. If you can find a contract online, or if you have any doctor friends, or even ask your gynecologist, like about the specific contract that you have to sign when you're delivering a baby, or when you're in labor. You want to find out what exactly is on that document. I don't know what exactly is on the document. I know what I said to you, because when I had asked my gynecologist in the moment when they were about to do the C-section, that's what he said to me. And I believed him, because trust. You've been going to see this man or this woman or this person for a while, and they've been giving you advice. But I'm having a lot of like epiphanies while doing this video. I don't think that I knew that this gynecologist was not for me, because he was not straightforward with me at all. Well, he was straightforward with me for some of the things. I would ask specific questions, and he would change the subject. He would answer it partially and then change the subject to something else. And for me, it's almost as if he was, I guess, avoiding some of the questions, because my research, I'm gonna ask some question, a lot of the things about vaginal delivery, because I had never planned to do a C-section. And up to this day, I still don't think I needed to do a C-section. I've never had surgery before. I've never done anything like that. That's what this video is about. It's really to advise, or not advise, it's really to tell you guys what my experience was, so it can help and benefit you, because trust me, yeah. So yeah, I think this is the end of the video. What I want to say is that you want to ensure that communication is excellent. You want to have exceptional communication during labor and delivery between you, the hospital, the nurse, the midwife, the gynecologist. Jamaica is seriously lacking in communication and providing information and knowledge, so the mother is aware of whatever it is she's getting herself into, as well as the partner, right? You want to be aware, you want to communicate, you want to have as much knowledge as possible. Ask all your questions. If anybody is resistant to your questions, they are not the ones for you. Trust me when I say that. I'm gonna end the video right here. It's been a pretty long video, so thank you for sticking with me throughout. So let me know in the comments what you think, as well as your experiences, and if you think I left anything else, if I left anything out from the video. Yeah, so Remember to subscribe, like, share, and comment, and see you in my next video.